Nice talking to you again today.
Always a pleasure, Dorothy.
John's not here this time.
I know, right?
I'm going to call the meeting to order. I think we have enough of a quorum. Can I get an approval to the agenda?
So moved.
Second.
Okay. Linda?
Yep.
Bert?
Aye.
Jill? Aye. Brooke?
Aye.
Okay, hi, everybody. I hope everybody is staying healthy.
Stay
Warm.
warm today.
We got the healthy part. How about warm?
Yeah. Okay, we're gonna take up where we left off the other day. So, which organization were we talking about that we said we were going to come back to? Sorry.
There's one that nobody had visited yet. Because you and I went to Safe Place, and I think there was another one.
Well, I met with, ASAP today. And we still have Fair Winds and the hospital to go. But I think we were having a discussion and said, oh, let's come back to that discussion, but my mind's been 100 different places in the last couple of days, so I apologize, everybody.
Frozen. That's what you are. Frozen.
I am I'm frozen. Let me just see if I can pull up my. No. Anyway, okay. While I'm trying to remember that, Linda, why don't you start with our visit to Safe Place? Linda,
Yeah.
you hear me?
Yep. Dorothy and I went to Safe Place, place we've been the last couple of years, and it was very informative. I asked her to send the figures, which I think Ann sent out to you this morning.
Yes.
Or yesterday, and it's quite shocking. The one part that they're missing is, and they expect that to rise exponentially as the kids go back to school, is that the teachers are usually the ones that sort of flag kids that are in danger. And because the teachers haven't been able to see the kids very much, they think that there's a lot of not only spousal or partner abuse going on, they think there's probably child abuse going on or emotional and physical abuse going on that's unreported because the kids don't have an avenue with which to report it, number one. Number two, the teachers don't see them and the guidance counselors don't see them. So that's the unknown quotient until they actually get back into school, but they do expect that to rise pretty significantly when they go back to school full time.
That's their children. That's their children to Witness to Violence program.
Yeah, Witness to Violence program. And so they've been rolling along. They did get some help, a shot in the arm from the Community Foundation when they needed it at the very beginning, and then again one more time. And they are working on their fundraising capabilities. So again, this is a very successful, and their outreach is really good, and they have a Spanish speaking and Portuguese available, and their outreach is good. And it's a very significant program here. They're seeing men, rise in men as well as women.
They had a significant increase in their funding this year, actually, which is great for some of the programs that they've had.
From where?
Well, for fiscal year 2021's work was because of Ali Raisman.
Yep.
Sorry.
Yeah, the
Her-
fundraiser.
Program brought in so much more money than they ever anticipated, which was great. And they said it really hit home with a lot of people. Because of course, part of that being because she was in everybody's living room, so it put a face to it.
They were
Yep.
gonna bring in, who was the other person they were gonna bring in, but because of COVID, they're gonna have to figure out how to reimagine that one. It was, crap. Oh, Smart. The smart girl that was,
Yes.
Oh, Elizabeth.
yes.
Smart.
And they obviously have to reimagine that, but they're still on that one.
Yeah, they're doing it this summer. It's a go. They're going to do it in a smaller number. So when the last time they did it, they had 100 people and they did a community program. This time they're looking at it maybe being 25 to 30 and then trying to work on how they can get it into the community as well. And I asked about Jill, I did ask questions in regards to their affiliation with PFLAG a little bit more again.
Yeah.
And there's been there's no financial restitution to any of to PFLAG by any way. They do have training. They came down, somebody did a training, and Safe Place now has 2 trained facilitators, and they do a support group, which nobody funds. They volunteer their time to the support group and provide that service.
Okay. Thanks for following up on that. I appreciate it.
Yeah, you're welcome. I did ask them about their strategic plan because their lease is up in 17 months.
Yep.
They have 1,700 feet. And they have gotten in over the last 4 or 5 years much fiscally or stronger, but they have not really started a capital plan to put funding into yet. And so they're looking at their options. They're looking at options, whether, they'll be renting, whether they'll be buying in the future, what they will be looking at to do. So for them, that they have a new strategic planning part of their board who are working on that now. That's one of their number one concerns is as they go forward. The space they have, because of COVID, is actually working out a little better than had been in the past because 2 people can't be in the same office anymore. So people are on different schedules, being able to see people, but they still have the clients they need to see. So that sense being said, only because of COVID, they're not in the office together, it doesn't mean their numbers aren't bigger. As they saw was it a 40% rise as you all got that?
40% in one and 30% in the other.
Right. And so, yeah, 40% domestic violence. And when they saw us, just for the record, when they saw us, they had a 30%. So there's been a 10% increase since when they presented to us in the numbers.
They said that was over the holidays, which was probably to be expected.
Right. But I'm just saying that they presented to us less than a month ago and they've seen a 10% raise in that time. So I think that they're a very strong organization. They have an unbelievable staff that have stayed with them, who are really dedicated to what they're doing. And there are people that are actually, what's interesting is that one of their staff members is working on 3 or 4 different organizations in the town, or nonprofits, and is making a mark in each one of those. And it's really cool to see that they have this great foundation. Jen has been there for, I think, 12 years and moved up the ranks. And her invested interest in, the sustainability of Safe Place and its advocacy is huge. We did talk a little bit about the changes in the court system, and in the strength that they haven't really been into court. They've done a few on the Zoom. They show up to every Zoom that is district court in case there's a need. But the change in the court system here in family court and how they hope that that will make a big difference in their ability to support families that come out of the domestic violence, because in past, there's been a great difficulty in our court system to do so. So they were pretty positive about that, wouldn't you say, Linda?
Yeah, they, they're just very positive about everything, really.
Can you elaborate on what the difficulties in the court were historically?
Well, they didn't have court there for a little while, and normally you go with the person.
Oh,
No. I mean, it sounded like there were challenges before COVID.
Challenges in family court.
Oh, yeah,
Was the
the
challenge.
judge.
The challenge was that there was you could present in court, they could come and present with families in court and with survivors or people that had been in violent situations and did not get the support in the court system. The judge tended to rule for the other parties. And so they're actually very excited about the fact that they have somebody in the court system that is, well, they don't know, they don't have a designated person in the court system yet because the judges have all been changing. But they're hoping that when they do get somebody, it's going to be a much solider and somebody that maybe has a better inkling of families and the importance of understanding the dynamic of a family and what their action can have on a family, especially a family that's witnessed domestic abuse.
They said so far it's been a positive. The judges said it's been rotating because they don't have a consistent judge down here yet. But they said it's been a positive experience now because they feel like they're being listened to.
Right.
So shocking that a family court judge didn't understand family dynamics.
No, we had one, she had no kids, no husband, no nothing, and she was lousy. We spent about a half an hour going over how lousy Kaplan was.
Yeah, we're not supposed to say name, but
Believe me, the two of us have had our go-rounds with Kaplan.
yeah, we just don't want, I don't want to bring I didn't want to bring names up.
I don't care. I can't stand her.
Okay.
Being
So-
recorded, Linda, so you better care.
I don't care. She's
Okay.
retired, she's gone.
Okay, getting back to it, one of the other things that they have restarted is, they discussed this with us before, was they did a program where they served dinners through BEAT, and they presented 1,000 dinners up until the summertime. They've restarted that. And what they found, they had 50% of the meals that were delivered, the advocates, delivered them. So they were able actually to see the families too when they were making the deliveries. She said it was a great program and they're very excited to be starting that one back up. And as far as their collaboration, of course, they've been working a lot with Health Imperatives and ASAP and doing a bunch of the support programs.
And they still have the store in there. In addition to the meals, they have diapers, wipes, some of the other essentials that young families need.
Emergency provision.
They have their own food pantry, which they offer food. They do a little bit. They said it hasn't been as cohesive a relationship with the food pantry right now as it was in past history. They do have their own, and when need be, they do send it there. But they have a small food pantry that they offer to families. You know, their job is not to, it's just to advocate, educate, and help people find the steps they want to take. You can't do more than that in any kind of program like this. You can only help a person to the point they want to be helped. But they feel that, well, we know that they make a difference. We know they make a difference. So, Linda, do you have anything else to?
No, but along, this is one of those essential food, safety, health, roof over your head. This is one of those really glaring success stories. It had a lot of rough years, and under this regime, they are just thriving. and they are providing essential services and have a real good place in this community.
Yeah, and I think that personally, I spoke to them on behalf of us and said, I'm sorry to hear that they're thriving.
I'd rather they not.
I'm glad that they're strong, but thriving is not what we don't want them to have. And, you know, right now, we would prefer that it was going the other way and that they were just able to be their support. So it's a little scary how much their numbers jumped, which shows us how important it is to have something like this available to families. And I think it'll be very interesting to see where they are able to go, what their strategic plan will be for the future in their location. Linda, anything else?
Nope.
Okay, sorry, guys. My better half came in and I'm in the kitchen and he's making himself lunch. So sorry about all the noise you're hearing in the background.
You didn't feed the poor guy?
Huh?
You didn't feed the poor guy?
No, I just got off. I was on a phone call with ASAP and or a Zoom with ASAP. So I didn't know he was coming home. This is a treat. But anyway. So I just met with, I had an hour and a half Zoom call with ASAP and NAMI, which was extreme. It was interesting to actually, I hadn't had a real chance to talk with Jackie, who runs the program on the Cape. I think Rachel, you know Jackie, correct? Yeah. And I love what I hear. I love the idea of them putting a lot more into dual diagnosis support and their educational program. They were talking to me about a thing that's called Think Kids. It's done by a Stuart Ablom. Sorry, I'm getting distracted over here. And they've done this program now in Mashpee, Barnstable, and Monomoy school districts, and it has been a 3-year process for them. They work with teachers and administration and community members and parents to bring and I think everybody should look up the program Think Kids if you have the ability to do so. They are now starting a program with Martha's Vineyard, which we need to get our name on that list. Again, these are one of the programs, we talked a little bit about the fact that over the years, Jill, you wouldn't know this, and Brooke, I'm not sure that you knew this except for in a little bit of conversation, is that ASAP itself has come up with some really great educational programs which have not been able to be administered in the school. They ran into a lot of roadblocks in trying to get it into the school district. And it's been very disheartening because it should be, my own personal belief is it should be a part of our everyday education, is both addiction, whether it's addiction to drugs or alcohol, and mental health should be a big part of our everyday education, to have a knowledge about it. It's just as we try to educate people about heart disease and diabetes. It's all the same. And I'm hoping that they're hoping to present to the new administration on this. I'm hoping to see them do it. I personally suggested they maybe talk with the school committee members as well. They've been working with the Mental Health Advisory Committee and they've tried to come up with a strategic plan on how to get things implemented here and what the needs are and what services are available. They've said they've been having a lot of conversations with Fair Winds too, which is nice because that was a problem before. We didn't have a lot of collaboration going on there. There was a little, but this seems to be a nice way to go. we talked about how does the ASAP feel about being involved with NAMI right now? And their feeling was that they were really looking forward to it, feeling it had elevated their work that they could do here because they have behind them an organization that is pretty strong in mental health um, and advocacy. Um, they talked about it being, and NAMI having an advantage of being an outsider, able to look into this community in a way that sometimes when we're in it, we can't see some of our faults or some of the places where we're weak on strategies. So they felt that that was to their advantage too, as they would be able to look in, but also have feet on the ground here. They believe there's a lot of work to be done, but their biggest hopes are that they begin to get into the school and that they can get the understanding and the stigma taken away and doors opened up for a better education of everybody in the community. One of the things that came up was that, you know, they talked about the stigma when the Al-Anon and AA programs had to move out of their building. It took so long for them to get anywhere, and it wasn't until ASAP and NAMI got involved that they were able to find somewhere. And the idea that it should take so long for an organization that does such support to find somewhere because of the stigma is one of the things they want to see, you know, that not be an issue, because they've had lower numbers in AA meetings. They're finding also with the newer people in recovery, because you don't have that bond that they need, but it took so long for some of these programs to get going. One of the things that came up is we don't seem to be hearing, you know, for a while on the front of our papers, we heard nothing about, oh, there's been this overdose and this has been going on with that. It's gotten pretty quiet on the news front, but I hear the numbers are up. And so we don't have those numbers.
How come we don't have those numbers? Do you mind me asking?
Um,
I mean, wouldn't that help us make a better informed decision here for what we're doing as well?
Yes, but there's two problems with that. One is they've been told the numbers are up by a representative from the police department, but there is no real data available, because one of the things that I think, you know, they want to see happen, and one of the things I think really has to happen is they need an epidemiology. Sorry, I have a problem saying words.
Epidemiologist.
No, report done. And we don't have one. Some places, the Vineyard has one done. Barnstable, it's part of their everyday, you know, like that's part of what they do. And we need one. And I don't know whether Rachel can talk to me or talk to us about that, but I know that that's one of the things. They've looked into how much it would cost. It's going to cost about $50,000 to have one of those done. But one of the grants, like that grant, Jill, that you had the hospital look at, right, and get, without a report like that, we look like a community that has this beautiful hospital free and the wealth of the world, but we have no numbers to present behind it. So
I know that was so frustrating.
Yeah. So one of these this kind of report gives a better equation to a grant like that could bring in millions to this community.
Yeah.
And an idea, so people have a better idea of how much this is actually affecting everybody. I think that if we really stopped and look at it, I think each and every one of you knows at least 3 people intimately it's affected in a very bad way, whether it's addiction or mental health. And we don't really have those numbers out there. And I think that that's, you know, when we go and we look at all of what we're looking at, every single program that we look at is affected. You know, Safe Place is affected through mental health. It's also affected because of substance abuse. Fair Winds, you know, the food pantry, rental assistance, you know, the Artists Association and their program and we're seeing frontline workers. Why is that? Because they're affected by it. So, you know, legal services, it's all, every bit of this is interwound together. And I think would be, it would behoove the town or an organization to get funding, and not just, I'm not saying the town, like the town should do it. So Rachel, I'm not saying the town of Nantucket. I'm saying the town of Nantucket as an entity of all of us to have this report available, you know, so that there, you can better, we can better, everybody can better look at funding. Everybody can better look at the need, and everybody can have a better understanding of it and how it actually affects us. So, anyway, that's one of the things that they're looking at. And
There definitely probably would be a great source of collaboration. There's a lot of history on efforts to get the epidemiology report. It started with the Behavioral Health Task Force, and they went so far as to actually gain quotes and get some of the work done. Roberto Santa Maria was on that task force and part of those discussions. He is doing his own PhD, and he would have been able to be capable to try and do something like that through his department. Other things obviously took over, and now COVID. So that's obviously not something. And I do believe ASAP did try to get grant funding, potentially through the CHIP, I think, to do this. But where the effort probably will gain traction is a collaboration. So it would be great to see something like that happen for the community, because I agree. I think it's needed. I think it's just a concept of who owns it and who's going to try to spearhead the effort. But I do know it was something that our own health director was looking at too, but
right. And I think if we,
fortunately.
and I think if there could be a collaboration, you know, it might be that NAMI is the hands that looks, that oversees as the information is put together because of where they stand. But I think that this is something, it would be very good for all of these organizations to come together and be able to put the statistics there for everything that we do, even for funding that goes to schools and everything. It's just vital that we understand it. And Brooke, I saw your hand up, so go ahead and talk.
Well, I was going to say, one of the things that Taylor Hilst and I had talked about before she moved into her position and left the Human Services Department was about seeking that there is grant money out there for communities like ours to do stuff like this, and that we were sort of thinking that the Council for Human Services could be a good place to initiate some grant request projects for stuff like this. And we are certainly at CHS looking, you know, working to foster collaboration among the human service agencies, and it's starting to happen, and I think it's going to build over time, and this naturally sort of falls into that effort. So we can bring it up as an item at CHS in the near future.
Okay. I mean, I don't know where it stands as far as if you were to get, if there was, you're saying there's grant for public funding to do it, to fund a public entity?
Yeah, so Taylor seemed pretty sure that there are grant opportunities that the town of Nantucket has not capitalized on in the arena of human services. She had some communications with other regions and communities in Western Mass who had gained access to a lot of funding that we probably haven't tried here, and I suspect with the new administration there may be even more federal grants available for stuff like this. So community assessment and program planning and that kind of thing. I don't know. It was just a conversation she and I had months ago that.
I did some research into the programs out in the Western Mass for my last year's thing, because of the fact that I actually was looking at the hospital funding and how hospital funding went, and it all fell into something that Partners program out in the Berkshires was doing with collaboration with the towns out there. And so yep. I had seen that there's a multiple grant done. It is held by the Board of Health their grant is held by the Board of Health out in the Berkshires with a collaboration with MGH's building out there. There, I think it's called the Berkshire. I don't know. I think it's in Pittsfield. I think the hospital's actually in Pittsfield, working the Great Barrington area, where, as we all know, their statistics are pretty high.
Yeah.
But we don't know our statistics. That's the problem. We might have some of them, but we don't really know our statistics here.
Yeah. No, I mean, I think that's a great initiative because it sort of guides program planning too, right? And the ability to get more money, because if you show the need, then, you know, other funding sources are accessible. So I think that's a great project to move forward. I'd love to chat with you more about it.
Yeah, I think we should, because I think it's something we need, and it would clearly answer a lot of the questions that we have in front of us, you know, all the time. It makes it much easier to look at. So I actually thought it was a great conversation. Of course, the same people here with their feet on the ground here. I know that Sue Franzuto is working for them too, ASAP. Now she's one of their employees. I did ask the question, what would happen if you didn't get your funding? What does your funding go to? Which I think is important. As we asked, you know, we asked the Artists Association, we did ask that question of Safe Place, and I don't think we responded to that one, Linda. So I'll go back to that, but and it actually supports, so that money, as everybody knows, is in a restricted fund through NAMI for just Nantucket. It cannot be used for anything else but Nantucket. And they told me that it runs over 85% of their programming. That without it, you know, their programming wouldn't happen. They don't have a lot of funding. The biggest thing that we've talked about is in the past is this is not a glamorous organization to give money to. So funding for them is extremely hard. It's always with any move that they've made, funding has been just, they hit walls a lot. And so for them, that is a major part of their programming funding, the money they get from the town of Nantucket. They did mention that they were the recipients of the Sandbar gift last year, and they said the program would have shut down without it. So it's very important that we understand that this, you know, this is a vital program, and funding for them is extremely important. And with the Safe Place, the funding that we've always done is their hotline is part of it, and for them, they have funds, but they have, again, you know, as every program, you get restricted funding to different areas. And our funding goes to support the hotline is one of their major funding that we do, and there is no other backup for them on that. And the court advocacy programs. So, and some of the case managements that they see, some of the people that they see in their day-to-day services. They did tell us that they were still seeing about 25 children in the Children Witness to Violence program, even though they're not seeing the numbers come from the school. So that's still quite a bit. Linda, do you remember how many people all in all they were seeing clinicianally?
No, they've got several clinicians that rotate in and out of that space. I don't remember her saying that, except that's why I asked about the percentages. They were just up.
Yeah, she gave me some numbers, but to be honest with you, I'm sorry, guys. I don't remember.
Hey,
It's a lot.
Dorothy, I have
Yes, please.
I have a question. When we talk about case management services at a Safe Place, how do they define that? What does that include?
They do one-on-one therapy with clients.
Okay.
So they follow through with them and offer support, mental health
Okay.
and guidance.
Okay. I think of case management in terms of
Units?
like coordination, resource coordination.
Yeah, no, well, so part of it is like if they go in there and somebody needs help with maybe getting food stamps or whatever, they help them with that process, but they're also there as their guidance, their
Mhm.
social worker, basically, they do.
Yeah.
So
Yeah. Yeah. The reason I ask is that the Family Resource Center is picking up a lot of case management stuff under this COVID response.
Yes, they
And-
did mention that.
Yeah. And one of the ideas of that is to build the reputation and awareness in the community of FRC, because they do a lot of that wraparound case management stuff, like helping people apply for federal and state programs. And so they're doing a lot of that work, and they're happy to do that on behalf of other organizations who specialize in other work. So that's where some of this collaboration is building. So
Well, I think that collaboration has been going on with them for a while, and she did mention that that's
Yeah.
one of the places where they send people.
great,
I think
good.
I think they're very
Great.
good at it. I think these organizations all are very good at their, most of them are very good at their collaborative efforts. Over the years, we've seen some of them that weren't, but we're seeing that definitely it's begun to get much stronger in some of them. And we've actually held a lot of them accountable over the years as part of, so why aren't you doing this? And can you explain to us why you aren't? Because in order for their programs to work well, they have to collaborate. They all are in need. I mean, there isn't one of these programs that doesn't affect the other program one way or another.
Well, and we're not paying for duplicated services and resources, right? So
Right.
unnecessarily.
Right.
So
Yeah, most of these places have got their jurisdictions and they work together. When they can't meet a need, they send them to the other one.
Yeah.
great.
Yeah, it's been fun to actually over the years, Brooke, to actually watch how they've developed, and how with some of their administrators, what a difference we've seen in how they collaborate and how they work together and how they utilize each other's services. There's some that don't, and that's, I think we all work on trying to get them to be better, but it's really cool to see.
hmm
So,
That's great.
yeah, and I know that Jill, you backed out last week because of the Artists Association, and you left early. We were in that discussion, and when you left, and I know that you can't have any voting or any talking about it, but I would want to let you know that I think they presented well to us. They presented they're doing a great job, and it looks like they're meeting what they came forward to us to ask for. They've definitely met the needs of what that grant was for, and they have definitely adapted to COVID steadily and kept their doors open. Actually, it's really cool to see the fact that people are actually being able to go in and do it on site. So I think that I can speak for both Linda and I that we were quite impressed that they did exactly what they had set out to do and did it quite well.
Oh, I'm glad. to hear
They're a dedicated group of people, let me tell you.
Yeah. So I know that you can't say anything, Jill, but you should know that we did talk about it, and that is the feedback that we gave to our board on behalf of the Artists Association.
Oh, good. I'm glad. Thank you for letting me know.
Very successful program, I gotta tell you. Very happy to see something that we funded for the first time actually come through and exceed any expectations we had last year after we did a pilot with them. It's just phenomenal.
Yeah. It's a special place, and it's kind of, Nantucket is special because of places like them and what they can do. So, and we're unique because we have that. Just, can I tell one little quick story? And it has no bearing on your decision at all. So it doesn't, but the things I learn about it as I go on. But a friend of mine here, he's one of my best friends. He's an architect, and he's gay and married to my other best friend, and they're now married. But he grew up, he's almost 70, and he grew up, I think, feeling very different than his friends. And ultimately, his dad found a place for him that was basically an artist association in their community in New Jersey. And that's what taught him how to draw. And he went on to become an award-winning architect now. And I always thought, wow, that's so neat that all those things fit together for him. And that he had this artist association. It wasn't just for summer people to come and take a painting class. It was really meeting a need for someone in many ways, not just in drawing, but they taught him to draw, and he still draws in 1/4 inch scale. And nobody does that anymore. Nobody. He doesn't have anyone he can find, even at Ridzi where he went, who can draw in 1/4 inch scale. And I'm like, we've got to make sure that we have this art community to teach people these skills, because there are skills in it. It's not just for fun, you know? Anyway, sorry, it was just on my mind. So.
That's cool. No, I think it's important that we all understand the impact all these organizations have on each and every person that comes into our lives.
It's about more than the art, a
Right?
lot more than the art.
It is. And that, I think that's true with all these organizations. What they do is got more to do than with the Artists Association, or whether there's a snack at Small Friends. It's got to do with the kids knowing that somebody cares deep down inside of them. And for children, food is one of the #1 things that makes the brain think that they're okay. And when you think about mental health, it all goes back to, they all root back to something, you know, and they all can affect something so greatly. And that's why sometimes this is a very tough job we have, when we have to look at organizations and say, whoa, wait a minute. Why are they doing this, or why aren't they doing this? And have they met their criteria? So,
Right.
With that being said, one of the things, I didn't make an adaptation to this before we go on a little further. I have to go up to my office, but we were sent a bunch of minutes. Can we add that to the end of the conversation, Rachel? No?
No, that's be on the agenda.
No, you have to list them on the agenda. So you can go on for next week. Or
Okay. On
whenever.
the next meeting?
I'm used to weekly meetings, obviously.
Okay, awesome. So if everybody got those, they should read them so they can make any changes that they see need to be presented to us. I just have to go upstairs and grab stuff. I'm sorry, because I'm just running a little behind. I've been off island for a good part of the week. So
They say in the army, smoke them if you've got them.
I'm just going to run upstairs real quick and get the other quarterly reports, and we can go over the ones that we had in front of us, so we can approve or tell, you know, Ann that we're okay with them. Okay.
Okay, one thing, what happened was, the ones that were missing, they were sent to Jericho. So I asked them all to be sent to me from now on, and Jericho from now on.
Okay, great.
That's why those 4 were missing.
Okay. So I'm just going to run and get those, and we can quickly go over, and then Rachel, what? Oh, I thought you were.
Nothing. Jericho's normally the right person, but yeah, and
Okay, I'll be right back, guys. 2 seconds.
Rachel?
Yeah.
And so I guess I really go. I guess it's not.
What's that?
That way, so it would be up to.
what?
Did you guys say something about the quarterly reports? They were sent to Jericho? Oh, okay.
No, I said Jericho would be the right person. It's
Right,
just-
exactly. So
It's
that's why,
on time right now, so
I know. the
getting them
4th.
to you
Yeah.
and, or me,
Yeah.
something works, but.
Yeah, that's fine. I mean, I told him that, you know,
Yeah,
and then I
Yeah.
asked them to send them to me.
I mean, I'd rather have them deal with it. 'cause
Yeah.
people must know is-
Rachel, do we have any word on if we're getting vaccine next week?
And then
We have vaccines coming, yes. There's already people scheduled to get them, such as like the Homestead and a few other places are being
Maybe
scheduled.
you can get it from.
When are they gonna start? Us poor 75+ people.
Everything's getting scheduled and appointments are starting. I think we are in a much better place than many communities, but I know it's never fast enough and people want those shots right away.
Hey, John.
I can load in on that. I know my wife,
Oh, my God.
she's scheduled for next Friday. I, for some reason, did not get that notice, so, and I know of at least one other person who got a notice and logged in last night. I'm not sure. She's going to the FW, but I'm not sure when. So there are people starting to get notices, but I would have thought I would have been high on the list, but obviously not.
They said.
There's a lot of people on the list, but I think
Email, John?
I'm gonna have our.
they're
lawyer
slowly
on
filtering
this.
through it and
It's letting
scheduling,
me
but we
her,
sort of are
like,
at the mercy of how many we get
or,
by delivery. At one point, we were told only 100 a week, I think it was. I wasn't in on the meeting, but that's what I was told, but that has changed because obviously that would not be sufficient for our needs. So there's a lot of work going into it. There's like over 4,500 people signed up that they're filtering through, so they'll get to you, don't worry.
Rachel, what is it? Is it the Pfizer's or Moderna?
I don't specifically know. I think it's been a mixture of the both, but because I know that
I can't take the Moderna. That's why I'm
Okay,
waiting.
well, when you get your appointment, you can just deal with that directly with them. I don't have that level of detail.
And Rachel, they do know that he moved the 65 and above up right behind the 75 and above, correct?
Mm-hmm. They just
I
changed
signed
it
up-
from
I
75
signed
to
up for that
65.
Hey, John, did they send you an actual email appointment?
No, they sent, I didn't get anything yet, but Judy did get a specific notice where you could then specifically register for an appointment in response to that particular email notification.
Okay.
John, do you have your notifications turned on in the gateway? Because I noticed that my husband's notifications were not turned on. So you might want to go into the patient gateway and make sure that you're signed up to get emails and stuff. Yeah.
I do get the regular notices.
Okay, great. Then you're probably fine.
And yeah,
Okay.
I think I got a generalized notice yesterday. And so I assume there's nothing more to sign up for.
Yeah, I got that one too, John, yesterday.
Yeah.
Okay, guys, I love you all.
Okay.
We're gonna go back to the conversation we're supposed to be having. And we are just gonna review if anybody has any questions over any of the contracts that have come in for payments. Oh my God, Dorothy, I'm totally losing it, guys. Does anybody have any questions over our quarterly reports? Brooke?
So we have the salaries for the hospital employees, but we don't know who did what. So we really have no idea what dollar amounts went to each segment of the grant, right?
Correct. Do you want to find out? I'll ask.
No, I think it would be helpful in the future to have it broken down a little differently, and that's just how the contract's written, right, Rachel? That we ask them to, if they're able to, if it's cited as staff compensation to support these services as opposed to staff hours. And do we care, I guess is the question.
Well, I think some of it is that I thought last year when and that's what we've talked about with what Rachel brought up before, is that we have to be more explicit on how we're doing the grants, because the advocacies, the healthcare advocacies are actually part of a paid staff of MGH. They're mandated in the state that the hospitals that have them. And if it's a mandate, why are we funding any of it? You know, because last year when we discussed it, it was, you know, our discussion, our end came that, well, most, 90% of people seeking medical help seek it here on the island, and seek it either emergency care or, some form of care at the hospital. So they're all benefiting from there being health insurance anyway. It's not like it's just a community thing that we, need to support. The community needs to support that when it's mandated that it's available. They have it in Boston. You can go to MGH in Boston and meet with somebody. You can meet with them on the Vineyard. You can meet them at Cape Cod Hospital. So that being in there is not something I believe that we all had thought we were supporting. And so that's where we have to get a little bit better for fiscal year 2022. And if there is something that we don't want to support, that we do that. They also didn't let us know, I think the other thing with the hospital was they had the total number of patients, ambulatory care, and that can't be correct, you know? That's the number that they normally see in a year. And taking the number that we had given them in a grant, that would be gone in the first month. Or first quarter.
So that's the certified application counselor line?
Yep.
Okay.
So we really have to get better at making sure that that's not in there. Or if we want, you know, making sure that we know exactly what the funding is going to.
Mhm.
You say this is exactly what the funding is going to. Any other questions? And we never heard back from the Interfaith Council on the Reformed paperwork, or did you send me something that I did not see?
Let me check. I thought I sent it out. Let me check.
Oh, you could have. Like I said, I have to apologize for where I've been. Yeah, this one I think we definitely have to ask them for a much different
Janice.
paper. Wouldn't you say on this one from the hospital?
Well, it's just that it's broken down differently from how they applied for it, right? There's
Monday.
1, 2, 3, 4, 5 buckets in the application and 8
Monday.
in the report.
For fiscal year 2021 or 2022?
Well, all right. So this says 20 October 1st, 20. So it's FY 2021, right? So the last sheet, the grant request, the chart that they categorized their or quantified their request by program.
This one?
This is 5.
Um,
So there's 5 no, these are the salaries. Sorry. I'm confused.
Okay.
Oh,
So-
never mind.
So I guess my question is, Rachel, on the one that came in, I think we talked about a little bit last time, quarterly report, Exhibit C. The behavioral health ambulatory transport. They say they served 12 clients at 40.26 hours. Is not the transport is the people we were transporting off island. Isn't that we quantified that there were about 12 that they would transfer a year?
I think that's what our estimates have, but if you want to ask for some clarification, like one thing that I've said before too is sometimes they will give you the full report of clients served, which makes sense, not just what the grant's covering. So it could very well be that they did that and it cost them $50,000, but only 5,000 was applied against that 50,000 from the grant. So how the report is done is they're just giving you all the service they did during that period versus just what was applied to the grant. It's not broken out specifically that way.
Right.
Services we didn't pay
Because
for.
when we gave the 100,000 or was applied to them for the 110, I think it was for the ambulatory services, or 100, it was under the idea that that would cover about 12 clients a year to get ambulance service away. Correct?
I think that's what our estimates were based on what the hospital and other people were saying the cost per transport average was. Yes.
Yeah. So I'm just wondering how we have 40 hours and 12 clients. But I thought we were just paying for the ambulance itself to get off island.
Which could be the case. but they're probably just providing you all the information that that service did, which is why I'm
Yeah.
saying if you want to just ask for the clarification.
Yeah. I
So
wanna
for
reiterate
instance, even Fairwinds will probably give you their report that says this is how many clients we served who are underinsured or uninsured. But that doesn't mean that's what the grant fully funded. Maybe it only covered 50% of that or so forth. But for them to break out specifically, and then it doesn't give you a true picture of what their utilization is overall as an agency. So that might be where you ask for those reports to be maybe a little bit more clarified in the future, how you want that information presented to you or what you feel is necessary for those reports.
Yeah, because I'd like to know what the cost, I mean, you tell me 40 hours, behavioral health ambulatory transport, but we didn't fund anybody giving social service hours for ambulatory transport. We just funded ambulatory transport. So I want to know how many people were transported and what came out of that transport. So yeah, yeah, I want to make that a little bit different so I have a better understanding of how much it actually is. Okay, thank you, Rachel. Okay, any other questions on any of the other? No? Okay, so the only request, did anybody have a hand up? I had my head down, sorry, no? Okay, sorry. Anne,
Yes.
on these, I guess the only request we have is we have not gotten, have we gotten the reform thing? Did you send me it? And I didn't see it?
I sent it out again just now.
Okay, thank you very much. So can we just ask the Cottage Hospital, maybe I'll talk to you or send you an email on how we can ask the Cottage Hospital for a better breakdown on their quarterly reports?
Yep.
Okay. Okay, so I think we're okay with the quarterly reports. Are we, everybody?
Did we get them all?
I think you got them all in the last few days. You just got Fairwinds. You got ASAPs.
Are we missing South Coast or something?
Yes. Did you get that email I sent?
Yeah, they're the only ones that are delayed for their budget.
Right.
And the figures from Elder Services, because they don't get their figures, you got the request for payment, but not the figures, because they don't do them, I guess, until the end of the month. So as soon as they are done, I sent that email also.
Yeah, I saw that one. Yep.
Okay.
So Elder Services.
That comes from the Cape, the invoice
Cape
comes from Sherry.
Yep. Cape and Elders. Cape and Islands Elders thing.
Right.
Anybody have any other questions on the quarterly reports? Do you feel that they're presented well to us with enough information, everybody?
Yep. Doing much better.
Okay. We don't have to make any motions on this. We just looked at them, correct? To oversee them. Am I correct? Rachel and Ann?
Yeah, you don't need to make any motions. You can ask for clarifications, but no motions are needed unless you are asking to hold payment on something. But usually then that just is a motion for us to review it and hold it against the contract somehow and manage that way. But
Okay,
it doesn't
great.
sound like that's needed.
No, that isn't. I think I just wanted to get a better breakdown on the hospital one, definitely.
Did we have a quarterly report for mediation?
Cape Cod mediation? Yes.
Should be.
Yeah, it was in there.
Was it in there? I had one that I had trouble printing out, so.
I had a couple that went totally black too. I wish I had the skill that, or the ability that Brooke and I think Jill do, to have two screens in front of me.
Yeah, it's pretty helpful, I have to say.
I'm using my phone, guys, to pull up a screen.
Actually, I don't see theirs.
Yeah,
Okay, I'm gonna send it again.
yeah, I just have the scope from, but not the report.
Yeah, I didn't get the last one that you sent again.
From Janice?
Yeah, I didn't get it.
Okay. I'll send it again.
Thanks. Hey, guys, Ann and I looked at dates for our next meeting. I have to go off to Boston for a few days for medical reasons, so we're wondering if we could do it next month, not this coming Monday, but the following Monday.
What's the
No, it's a
what's the
holiday.
date of that?
Holiday.
It's the 8th. The 8th is not the holiday.
No, it's the following week is.
Yeah, no, the 8th.
Oh, bear with me one sec.
What time?
10 o'clock.
I can't do the 8th, sorry.
There's about 100 cars going by my house beeping horn.
Why?
No idea.
The 8th is kind of rough for me.
All right. Jill. John.
So what day works for you guys?
I could do Wednesday, the 10th.
Yeah. Everybody else, how does that sound? Bert? The 10th?
Whoops. That's okay with me.
Bert?
We're doing it on February 8th at 10 o'clock?
No,
No,
we're
wait.
talking about
No.
whether we can do it on February 10th at 10 o'clock because Brooke can't make Monday.
Okay, I couldn't hear it because 2 or 3 people will start talking at the same time. I can't hear what you're saying.
It's on purpose, Bert. Does that work?
Oh, shoot. Oh, sorry.
What day and time? I'm sorry.
We're talking about not next Wednesday, the following Wednesday. I'm hoping by then.
The 10th.
That's fine for me. 10 a.m.
Brooke, good for you.
Yes.
John, you're not going to be out playing golf?
The only reason,
Hopefully,
the only reason it wouldn't be fine is if I had to have my pin
Appointment, yeah.
changed at that time.
Well, if you do, we'll excuse you so that you can get your COVID shot. Bert?
Yeah, the 10th at 10 o'clock.
Okay, Ann, can we try for the 10th at 10 o'clock? Please and thank you.
Just to clear it with the command central.
Yeah.
Yeah, Erica, yeah.
That's what I'm asking her if she can check in with them.
I sent everyone Cape Mediation again, and Dorothy, I sent you Janice, because you said you couldn't get it.
Yeah, it just didn't, I haven't gotten either one of them.
Oh, okay.
They still haven't come in, so I don't know what's.
It might just be a lag. We've had multiple email issues over the past couple days with upgrades, and sometimes external emails are hung up. They
You've
should be
had trouble with your
fixed, but
phones too.
yes.
Let me
Not
tell
sad
ya.
about that.
Okay, so at this point, I think we should discuss some of these organizations and our funding. We do have 2 more that we'll have to hear from, but I think we should restart our deliberation process here. Is everybody okay with that?
Mhm.
Okay. So. Can I tell you, there's just too many damn papers involved in all this?
I concur.
You don't understand. I have to keep everything from all the meetings by law. You have to keep them. You should see some of my notes and the little drawings on them, and I have to keep them. I have now a box just for contract review committee, a huge box. Okay, so one of the things that came up in our last discussion when we started deliberating and then we went into this was that we were discussing funding things just because they were small and we would be okay funding them and then moving on to the others. And that became a question as to whether that was the proper protocol for us to be doing it. Now that we have some idea on some of these organizations, is everybody still comfortable with the numbers that we've set forward for the organizations so far? And I'll go over those with you, okay? Cape Mediation, we had funded completely. Small Friends, we'd given a full funding to. Martha's Vineyard Community Services, we had made a recommendation. These are all recommendations, guys, for a full funding. And South Coast Legal Services, we had an Elder Services. So I think that what might be best is don't look at your total numbers right now. Okay, everybody? What I want you to do is look at it this way. With the organizations that we've presented, and let's talk about them, would you fund those organizations? And how much would you fund them? And then I think we go back and discuss where we make cuts if we have, and when we make cuts. Does that make sense?
I'm a bleeding heart liberal. I'll fund everybody fully.
Okay, Linda, get your checkbook out.
Yeah,
I still wear a peace sign around my neck, guys, though it's diamond and platinum.
I know, I feel the same way, and I'm not a bleeding heart liberal at all, but oh my gosh, I feel the same way, Linda. I do. The groups all seem great. You all know that I personally feel like the food pantry is probably well funded though. So for me, maybe that's an area we can look at. But I'm having a hard time, so I'm going to listen to all of you.
okay, so
Can I ask a question, Dorothy?
yes, Brooke, I was just coming to you.
Great. So, so I guess the question is, in my mind, is there any part of an application that we don't find worthy of funding? Is the first conversation. And then we'll go back through and say, okay, of all the things that we agreed are worthy of funding, where do we have to make cuts to meet the dollars that we have available? Is that how you would describe it? I'm just trying to wrap my head around it.
Well, basically what I was saying is we presented, do you think that ASAP, or not ASAP, Safe Places was number one on this list, so I'm looking at it, is Safe Place, does it offer a program, and do we think their funding is at that level what we want to fund? Some of the programs we can look at, some of them we can look at and say, wow, I don't necessarily want to, right off the bat, I can tell you I don't want to fund that percentage. And I think if we go down that way, then we can look at where we have to make cuts from there. You know what I mean?
We have to cut about
Yeah.
$100,000 off the top of this somewhere.
Right, but I think we have to see where we find we all strongly believe the funding is really necessary, and where we find the funding maybe isn't as necessary. So
Well, do you want to start at the top and just go down the list in order, full fund, not full fund, check it, and just see who's going to get full fund on a first go round? We do that on the CPC,
well,
and
I
then we go back and start adjusting.
I think basically that's what I just said was that we're going to look at each one and decide where we want to fund, and then we'll go from there. I haven't gotten a presentation from the hospital yet, and I honestly, I have, as everybody knows, some reservations on some of that funding. So I'm not not speaking, but I, I want to know more before I speak and say, well, I definitely feel that way. I'm very strongly believing that.
Well, let's start with Safe Place, may we?
Yes, I think we
Okay,
should.
I would level fund them, which is what they asked for, 55 again.
Okay,
I
you're
would
making
agree.
a recommendation on that?
I'll second that.
Okay. Bert,
Aye.
Linda,
Aye.
Brooke,
Hey,
I,
John,
aye.
Jill?
Aye.
These are just recommendations.
Yep.
ASAP,
I want to come back to that one.
want to come back to ASAP?
Yeah,
I would suggest that we fund them at 44,200, which is what was last year.
they're getting, since they went with NAMI, they have more access to funding. That's what concerns me.
Well, I don't think they actually have more access to funding for the Nantucket, and I think that's what I told you. I think eventually it'll open up to more grants, but not right now in this process of what they're doing. It might open up grants in the long run, but it doesn't open up more funding for Nantucket programs at the moment.
Mm, I
in
know.
the Foreseeable future. So, Brooke?
so I see, as I looked through these and tried to figure out, hey, where could we pare something down? The one thing that stuck out from me on this application was the anti-stigma campaign. It's a very large, it's a pretty large number. And while I think it's important, it's not direct service to
Yeah.
to people. So I think it's probably an area that might a haircut in that particular part of their programming might not would have the least negative impact. That's a double
much-
negative,
which
but you know
one-
what I'm saying?
How much was that, Brooke? How much was that total?
Hang on, I gotta pull it up. It's like 14,000 or something.
Okay,
But we all realize that stigma is the biggest problem going on for people in addiction programs. We all understand that, right?
yeah, but we can't fund everything right now.
Huh?
It's
I'm just saying,
It's-
it's just as bad as any other organization look at what is Anne putting on her head?
She still doesn't get that we can see her.
Is I think that it's important that we understand that stigma is the biggest thing. Even the state of Massachusetts is backing right now. Is their biggest movement? One of their biggest movement is their anti-stigma programs. Because
I understand. Yeah. I understand. However, like I'm trying to figure out like if I'm looking for possibilities of where we could haircut something, not saying that we definitely should, is all I'm saying. So I would wait on agreeing to fully fund this until we can have a conversation, further conversation around where the haircuts are going to come from.
okay.
Well, also, well, no, never mind. I like what Brooke is saying. I probably just don't know enough, Dorothy, about the anti-stigma campaign and what that means. It seems to me there are a lot of ways to get treatment here in private as well, through Fairwinds and Dr. Lepre or whoever. So I don't know. I guess I just don't really understand what that is.
Okay, I'll clarify something right off the bat. There is not that much treatment here at all. Okay, anti-stigma is the stigma of the fact that it took so long for Al-Anon and AA to get a place, because who wants some drug addicts or alcoholics in their buildings?
Well, my church did. So Summer Street Church would have them. They had them a lot. I don't know if they do anymore, but
I think what I'm trying to say, Jill, was the stigma for the organization itself to try to find a place until it actually got NAMI and Safe Place and ASAP behind it, is the stigma of people understanding. I was part of a support group that was held at the Oddfellows in Rebecca Hall. And it was a parent support group there, and the members didn't want it there because they were afraid there was going to be drug addicts showing up at the buildings. Not understanding any, the importance of better understanding any disease, no matter what it is. Rachel?
Yes, through you, Mr. Chair. Some of the things, I think I'm technically still on the ASAP board. Unfortunately, I haven't been attending many meetings, but some of the things that they had done was the, I guess you could call them ads right before movies at the Dreamland Theater, where they place actual people with voiceovers or faces of people in our community that were either personally battling, overcoming, in recovery, or family members. So what they were trying to do is humanize it and say this affects all people. So that's sort of the stigma campaign. NAMI was doing some of their own efforts as well through grants and things that they had. So like at Stop and Shop, you'll see the mental health sticker that's on some of the carts. That was some of their effort as well, to get it out there, get the information out there and advertise it so that people would talk about it and it wouldn't be this hidden secret or something to be embarrassed about. So I think that's more what is talked about in terms of the stigma campaign. So a lot of the conversations that surrounded NAMI, ASAP, the Behavioral Health Task Force, the CHIP grants, a lot of things that were coming up is people, there might be services out there, but people were afraid to talk about it or seek help, or they felt embarrassed, or that people were going to look down on them, and it affected all walks of life. So how can we get it out there that people are saying, hey, I've done this, I'm in recovery. If I can do it, you can do it, and gain support, so that it's a conversation. And some of the examples that people were trying to build upon, I'm sure you've seen it at some point when we were all allowed to travel better, was the wall that exists between two of the terminals at Logan that has all the different actors. And so they were trying to mirror something like that for here. So that's what's meant by the anti-stigma campaign. So they were trying to get more of that going in the community. That's my understanding of it.
Okay.
Brooke?
Well, then with that, I have to really kind of back up what Brooke is saying. I think if there's an area that needs tweaking, not that we want to tweak it, but if we can't fully fund everybody, then I feel like I agree it should be more about services. I don't know. I know a lot of people that go to AA meetings every day, and
Yeah.
I've just heard
yeah.
of that as being like a problem to, it seems like they want to go and they have a great community of people. And
Well, they're only Zoom now. You know that. They've been Zoom.
yeah, no, I know they are now, but they used to meet at Summer Street Church and sometimes at Congo Church, maybe all the other churches. I don't know.
Well, they had a facility of their own, which they're out of, and that was the big problem. They had a place where they met 5 days a week, 2 to 3 times a day.
Right.
And that is gone. I think the Summer Street Church is actually the Al-Anon program. So
It's my understanding that the AA is meeting at the Methodist Church.
we're meeting at the Methodist Church right now. Yes.
In the basement there.
So I want to be clear, I'm not saying cut 100% of this. That's not what I'm suggesting, of the anti-stigma campaign. I'm saying, if we need to, yeah, maybe I'm jumping to the hard decisions before we're ready to make the hard decisions. So.
I'm glad you brought it up, Brooke. Thank you.
Okay, so are we suggesting what? Are we suggesting level funding ASAP?
What did they ask for last year?
44,000?
No, I think she was talking about cutting more. That's why I'm saying come back to ASAP. Let's not figure that out right this second.
Well, Linda, we need to figure things out or we're never gonna get through this in time.
Well, I know, but I'm just saying just go down the list and see who's getting full funding, and then we'll figure it out. I think we know some of them which are getting full funding. Then we start, just subtracting from 650.
Brooke, something on the table right now. Brooke, was your suggestion level funding them? 44?
My suggestion is analyzing the anti-stigma radio campaign last year versus this year. How much have they asked for an increase in that? And I'm seeing that last year the anti-stigma radio campaign was funded at $14,400 and they've requested $19,800. So I think it's possible to level fund that program.
You're asking to basically level fund, that would basically level fund ASAP. Is that your recommendation?
Okay. I'm still thinking it through. Hold on.
Okay.
Hang on.
Garth got one and June didn't.
Yeah, so it's just time to look at it all.
Hey, John.
Okay.
John,
Wait a minute, Bert. He's busy talking to his wife. Yes, Brooke, what?
I'm sorry.
That's
Sorry, I'm still trying to do the math here. So the increase is 5,400. Yeah, so
It takes them back to level funding, basically.
Basically, you're saying you're making a recommendation. Are you making a recommendation for level funding, Brooke?
yes, I'm gonna make that difficult recommendation. I don't want to, but I am.
44,200?
Making a recommendation for 44,200.
So one of the things we were talking about was being specific about what we're funding. So,
We'll come back to that. But
okay.
So on that recommendation, do I have a second on the recommendation?
I will second it.
Okay. Brooke,
Yes,
Bert,
Aye.
Jill,
Aye.
John? I saw his hand go up, everybody. but-
Aye.
Okay, thanks. Linda?
Okay,
Elder Services, we're at 20,000. That
full
was,
fund, I'll make a motion to full fund them.
I thought we did that before.
No, we were talking about it. We just never finalized it.
Yeah, I'll second Linda.
okay, Bert,
Aye.
Linda,
Aye,
Brooke,
aye.
Jill?
Aye.
John? I see his hand, everybody. I know that doesn't count, though. You have to talk.
Aye.
Okay.
Thank you, John.
I'm gonna actually, right today, skip over unless you want to have a discussion about the Cottage Hospital, because I really want to talk to them.
what about South Coast Legal Services? That's what I have next.
Oh, sorry. Yep, you're right.
Yeah, we already did 46 for them the other day.
Yeah,
Yeah.
but again, we didn't finalize anything. We held it.
Well, we haven't finalized anything yet. We're just putting all these numbers in.
Recommendations. So we made a recommendation. Everybody okayed the 4,600 at South Coast.
Yep.
The prior time.
So then the next smaller one would be the Artists Association.
I'm not going to go smaller. I'm going to go right down the line. I'm
Yep.
asking to hold on number 5 right now until I get to meet with them, and let's
Yep.
go on to the Interfaith Council.
Yep.
Which is requesting 85,000. Jill, you want to just talk on this one?
For the food pantry?
Well, it's not only food pantry, it's rental assistance, food pantry, and fuel assistance, just so we know.
Yeah, but it sounds like on rental assistance, they got quite a bit of money from the CPC
CPC, yep.
because you gave them twice more than what they were asking for.
No, we only gave them 50 grand more than they asked for. They got 250 instead of 200.
And we went through.
Oh, sorry, I thought you gave them, okay, thank you. And, you know, I even know the person that's been fundraising for the food pantry, and I spoke to him. They,
And you will be getting.
to me, just like, I think we've got to fund them at some level for sure, but it just seems like an area that when they have a need, people are stepping up. That's just how it really comes across in their numbers. And we even see that in the newspaper, so.
My only worry about that, Jill, is that this is, the funding they're asking for is for next year. We don't know what's going to be available to them next year. That's the biggest problem.
Oh, yeah, and I hear what you're saying. I guess I just feel like they still will have the resources if they have the need.
If the community foundation has that thing funded, that's the only way they're getting anything is from the community foundation for the most part.
I think what's really important this year is that we've seen that a lot of these organizations, some of the nonprofits that are out there, a lot of them have made more money in this year in gifts than they have in previous years. Money they didn't determine they were going to get. People have given generously to a lot of the private nonprofits that we've seen. And so if we're looking at everybody and what are they going to have in a year from now, then we'd have to relook at all of these people, because it's not just the food pantry and whether they'll have the money, but will resources be coming into each and every one of these organizations in a year, So what we have is we have a certain amount of town funding that we can give to these organizations. And we have to look at what support level are we giving to these organizations if it was a common year. We cannot look at COVID because that's unfair to all the other nonprofits, because we know that some of these nonprofits have made more money than they ever thought they would make in contributions, and some aren't getting any at all. So I think that we have to look at it, not as, oh, where will the food pantry be in next year because of COVID, but what about all the others? Because what's important is they all matter. Each and every one of them are intricate parts of making the community work. So that's what I had to say.
I mean, has the food pantry come to us and said, hey, if we don't get 85,000, if we only get 40, then we're going to not be able to provide X, Y, and Z?
No, they have not. Brooke?
So Linda, I have a question for you. What portion of the CPC money is allocated to administrative costs?
I can't pull that out right now, but we do a substantial amount of it. I cannot remember how much of it, 80 grand maybe? That's just what
Okay.
it used to be. I have no idea right now because we readjusted it some over the last couple of years, so it was more of a direct service thing. So I don't know, but I do know that they get no money from CPC unless they have paid staff.
Okay, so I guess what I'm driving at is, if you funded them $50,000 more than they had asked for, right? If you look through their list of grant funding sources in their application, right?
Yep.
What Janice said to us, that this is used for administrative services. So of that additional $50,000 that the CPC granted,
that's direct
can
service.
it be? It's only direct rental payments?
Yeah.
Can't be used for administration.
They came in with a set amount for administrative and direct service. So any extra money is only for direct service because we are not paying more than what they asked for administrative.
Okay.
That's not the way that works.
So that's important to understand in the sense of, the portion of their ask is $41,000 for the rental program. Janice said that this grant is used for administrative, so the increased grant from the CPC can't be used to replace this, is I guess what I'm trying to understand.
Whatever
we would be leaving.
CPC is exactly what they have to use it for. We're very strict on that.
Grant funding has definitely doubled what they had in previous years.
Yeah. And I think the other comment I wanted to make is, we talk about appeal for community fundraising. Like when they do community fundraising, take donations from people, direct donations, right? I know I gave to them. I didn't designate what it could be used for. So it could be used for administrative services or food or rent or whatever. And so in a crisis like this, or if there's a need that exceeds their budget, the ask to the community for this is easier than some other programs, or will be more
Yes.
easily responded to than some other things. So,
Favorably looked upon.
I think that
Yeah.
was Bill's comment, was that people
Yeah.
will give money in a crisis like this to these resources before they'll give it to something else. They're first to hand out to make sure
On
people.
a lot of people's radar screens here, I think.
Yeah.
You know, Safe Place is not. I don't think that's where people think to give. They think that immediate giving. So, you
Yeah,
know,
no, she said that people just don't, it doesn't have the cachet. Let's put it that way. Safe place.
Yeah, and I think that's same with ASAP, it's
Yeah.
same with a lot of them. They don't have the funding. ASAP did a fundraiser, did a major fundraiser and we gained $1,000, guys, because they weren't offering alcohol. They weren't offering the one thing, because how can you offer a fundraiser? This was 2 summers ago, Rachel, I see your face. But they did a big fundraiser and they didn't, they had a great place, but they weren't offering alcohol. And the person that gave them the money came in and said, you know what? The one person that wrote a check that day said, if there was alcohol here, there would have been a ton of people, you would have made a fortune. Yeah. And it's very true. So I think that when we look at all these, let's think about a normal year, a year from now, not, and what are we comfortable funding?
what did they get last year?
They requested 75,000 and we gave them 70.
You want to level fund them?
Are you making a recommendation for level funding, Linda?
Yeah.
Okay. Do we have a second on that?
I'll second that.
Okay. Linda?
Yep.
Brooke?
Yes.
Bert?
Aye.
John?
Aye.
Bill?
Aye.
I'll tell you what will happen.
And
If
then we squeezed you. Can't believe it.
Yeah, but here's what I think will happen, because we gave them an extra 50 at the CPC for the rental assistance part. That takes some of the pressure off of that side, which means that they can reallocate towards the food pantry, which we cannot pay for. So I think it'll readjust itself out with the extra 50 that we gave them.
Yeah, and I think that they also got a gift that'll help them in another source. They got a gift through the same source that ASAP got theirs last year and Safe Place got it. So I think
The sandbar? They got the sandbar.
Yeah, but the sandbar changes it up every year, so I have no idea what happened to that this year. Did you?
I
Yes,
went to Interfaith.
we went to the
Okay.
interview.
Oh, good.
Sorry, I was distracted. What did you potentially
we're-
allocate to them?
Federal, we're gonna level fund them at 70,000.
Okay, thank you. Sorry.
You're welcome. Okay, next one up is health imperatives.
Full.
You're making a
I'll
recommendation.
second that.
Linda,
Yep.
Brooke,
Yes.
Bert,
No.
John? I'm sorry, John, you're muted. You're muted, John. Can't hear you. Hit your mute button.
I'm getting it.
There you go. Just leave it on, John. Just leave it on.
I have to hit my mouse the right way.
Okay, John, I asked you.
I said aye.
Okay, Jill?
Aye.
Okay,
That amount was 90,000?
that amounts 90,000.
Dorothy, I've got to get my daughter from school. I'm sorry, my husband couldn't pick her up. Can I can get back here in like 10 minutes, but
Yeah, we'll still be here.
Unfortunately.
We'll do Artist Association while you're gone.
okay, yeah, sure.
talk about the Artists Association, but right now, just so you know, that you guys already made a recommendation for MVY to 18,000, which was level funding them. Small Friends was level funded at 15,000. And Cape Mediation was funded at, their request this year was for $2,205.50, which we did. So
80
I
cents.
I think what we'll do is we will do the Artists Association and then we will cut it for the day so you won't miss anything. So
Thank you. I'm so sorry.
and we'll come back and do Fairwinds and
The hospital.
the hospital. Okay?
Thanks, guys. I'm sorry.
No problem.
Oh, we got to go back to ASAP. I don't know if we ever came to a resolution on ASAP either.
We did
44,200.
Okay.
level funding them.
200.
So we're going to talk. Bye, Jill. We're going to let you go because we're going to talk about the Artists Association anyway.
Bye.
Bye.
Hi, Jill.
Right.
Okay. Artists Association.
I'd like to give them the, how much did they get last year?
18,200.
200.
Yeah, they've been one of the groups that's actually been able to adapt face to face. And the program is wildly successful. So I just assume give them what they asked for.
You wouldn't recommend level funding them?
No, give them what they asked for this year.
I'd be more inclined to level fund.
And I would level fund as well.
Okay. What was that amount?
18,200 last
Wait, I
year.
want John, can I get your opinion on that?
Level fund.
So, did I hear somebody motion that?
I will move that.
I will second, Brooke.
Okay, so we have a recommendation from Brooke for level funding the Artists Association at 18,200. And we have a second from Bert. So, Brooke,
Aye.
Bert,
Aye.
Linda,
Okay.
John Balash,
Aye.
Artists Association at 18,200. Okay, so we have Fairwinds and Nantucket Cottage Hospital left to do. They will be met with, I'm actually gonna get off this and call Sarah and see what's up about and find out when that is gonna happen. So the next date for if Anne can get it is gonna be Wednesday, February 8th. So we'll discuss those two. That'll be our final deliberation.
No, that's the 10th.
In the 10th, sorry.
10th.
We'll discuss those two organizations. That'll be, and then we can look at the funding and make any final deliberations and recommendations. And then we'll start on the report. And then we'll set dates. I think we're in March when we're going to go in front of FinCom. So I guess, is anybody going away for February break?
Since he got out of high school, we don't
Okay.
go at all.
I plan on going to the VFW to get a vaccination. Maybe I'll be up by then.
Okay. Hey, Bert, you're not that.
What?
How old are you? Can I-
You subtract 1946 from 2021,
Okay, I got
comes
it.
out 75.
Wow, you are up there.
John
I'm
still
gonna
got the lead.
Okay.
Well,
I'm gonna make an excursion to
still
the
here.
Stop and Shop. But that's
Okay.
about it.
Sounds like,
You're
Yeah.
going in, huh?
sounds
Hopefully
like,
you won't have to stand outside in that god awful line. I'd
Um,
go downtown if I were you.
Rachel,
Mm.
will you guys be around? Yeah, okay.
Yeah,
Um,
even if I'm for some reason somewhere else, which I can't imagine where the heck I'm going, but I'll have remote access. So.
I mean, aren't you chained to that desk?
Either here or my kitchen counter, so I don't go far.
Okay, and guys, I'm sorry that this process this year has taken a little bit more time than we had hoped it would take. But I think with people new and with COVID, it's drawn it a little bit differently. Bert, yes?
Motion to adjourn, Madam Chairman.
Oh,
I will second.
There we go. I'm gonna go through it. Bert,
Aye.
Brooke,
Aye.
Linda,
Aye.
John,
Aye.
with the aye. Rachel and Ann, thank you again, as always.
You guys.
Yeah, and I really appreciate everybody's patience with me as the newcomer. Thank you.
Well, you asked very good questions. So there's no problem there.
I